Good evening, everyone. My name is David and welcome to another ACPP webinar and a continuation of a regular set of PD opportunities that the college will be running. Before we begin, I'd like to acknowledge the traditional custodians of the lands where my Australian-based colleagues are located today and pay my respects to their elders past, present and emerging, for they hold the memories, traditions, culture and hopes of Aboriginal and Torres Strait Islander people of Australia. In recognition that we are a binational college, I take this opportunity to acknowledge the Maori as Tangata Whanoa and the Treaty of Waitangi Partners in Aotearoa, New Zealand. This evening, I have the pleasure to introduce you to our guest speaker, Marissa Rose. Marissa is a registered paramedic in Queensland for 7 years, a remote mining paramedic and the host of a very popular The Paramedic podcast show, which can be found on Spotify, Facebook, and soon to be Apple and all other places where decent podcasts are found. I encourage you all to look up her podcast and listen. She's had some really interesting speakers and some great topics. Marissa has a passion for mental health and the well-being of paramedic workforce. Through her own interest and history, Marissa has developed experience in mental health well-being, equine therapy, and a particular interest in rural and remote medicine. At the end of the presentation, there will be a short Q&A. So for anyone participating, if you have any questions, I'll encourage you to write them down in the comments section and I'll go through them in the order that they appear. Without anything further, I'd like to pass the webinar on to Marissa. Thank you, Marissa. Marissa, you'll just need to unmute on the top right-hand corner. You'll just have to click down. There it is. Perfect.
Can you hear me now?
Yeah, fantastic. I can hear you perfectly.
Great. Sorry about that. Well, good afternoon, and thank you, David, for inviting me here to talk to everyone about two things that are very close to my heart: paramedic wellness and equine therapy. As David mentioned, my name is Marissa, and I have been a paramedic for over 7 years. I began my career in Mount Isa and spent about a year there before doing some time in Metro South, Gold Coast and Hervey Bay. I've also done some contract work to private mine companies, and I'm in my final semester of my Master's in Critical Care with the intention of becoming a critical care paramedic in the near future. Throughout my career and personal life, I've had to overcome much adversity and have been taken on a very interesting and at times volatile journey that has led me on the path that I'm on today. The sum of my personal and work experiences has led me on a journey which has allowed me to identify the importance of paramedic wellness, self-awareness, self-compassion, and maintaining a healthy inner self. This journey has led me to start my own podcast, as Dave mentioned, the Paramedic Podcast, which aim is to unite paramedics from all over the world, connecting on mental health, inspirational paramedic stories, and anything I think is relevant and should be brought forward to my colleagues. Something I do think that paramedics inherently do quite poorly is take care of themselves, not just physically, but emotionally, psychologically, mentally, and spiritually. We are fantastic at taking care of everyone else, but often at the expense of ourselves. And this is something I want to change, because in order to be a good paramedic, the paramedic themselves needs to be good first. Paramedicine, a career self-selected into by an amazing, resilient and giving group of individuals that find meaning in giving back to their community. But at what expense? It will come as no surprise to you, particularly if you have been a paramedic for some time, that this job is demanding in ways that can only be understood by those who live within the lifestyle. The abnormal becomes our normal, and throughout, the abnormal becomes our normal, and we are required to process events that some people may be never exposed to in their lifetime. This new normal for us may create an internal environment where we find it difficult to relate to those who are not in our field, or difficult to connect with those we have not shared this trauma bond with. We give up special occasions, weekends, nights with our families. We give up sleep, and we limit our ability to take care of ourselves and be mindful of our own needs because, well, as many of you can relate, that's part of our role. But my job today is to try and shift your mindset regarding this and foster a more resilient, mindful, and self-compassionate mindset that may lead to happier paramedics, which may lead to increased longevity in a career that we know to have a high burnout rate. You'll be right. Just get on with it. You're upset? Keep it to yourself. You're tired? aren't we all? Struggling to sleep, that's just part of the job. Short a fuse, welcome to the real world. Fighting at home, that's normal. Eating bad food, there's no time to eat healthy. No time to relax, no one has time to relax. Meditation, that's for hippies. Animal therapy, also for hippies. No one understands me. I don't want to be a burden on anyone. Why am I always so angry? I find no joy in my job anymore. I struggle to find joy in life anymore. These masks are so suffocating. The workload is insufferable. Why can I never get a break? Any of this sound familiar? It is no surprise that paramedics in this state of play, particularly since COVID has joined us, that we are approaching a total state of burnout, compassion fatigue, and lack of self-awareness and self-compassion that leaves us, at times, feeling exhausted. At times, it can feel like there is no cure, no way to cope, manage, or survive our new norm. We just float around in a state of baseline survival. But one thing that paramedics can easily forget about is the most important variable of all, the most important part of the machine, the piece that holds everything together and can change your perception and way of life, you. Given that we self-select into this profession, it could be a reasonable assumption to believe that paramedics are good at putting others before themselves. So good, in fact, that we often forget about ourselves altogether. Our emotional, physical, spiritual, and mental well-being should be of paramount importance in our daily routine, prioritizing our paramedic wellness. Now, paramedic wellness can look different for each individual, and what is important and brings me joy may not be exactly what brings you joy. But the self-awareness that we develop in understanding ourselves is crucial in order to prioritize these things in our lives, creating inner balance, harmony, happiness, joy, peace, understanding, and love for ourselves that is so important so that we may reflect this level of being to our partner, our family, our patients, and anyone we interact with. A paramedic who is functioning at a high wellness level, and by this I mean a paramedic who is self-aware, understands when they are triggered or not coping, and has mechanisms in place to overcome these triggers or issues, and the self-awareness to identify them in the first place, is a paramedic that will manage themselves in this current climate effectively. If we continue to ignore, repress, and not identify areas in our lives where we are struggling, and we are unaware of the cues or identifying markers that we may need help, to spend time regrouping and relaxing, to reconnect with the things that make us happy and who we are, we will undoubtedly approach total burnout often and perhaps be unable to perform our duties both at work and at home productively. So, how does a paramedic create wellness for themselves and within themselves? Well, this is a loaded question, and one that I'm always passionate about finding the answer to in each individual I come across, both at work and outside of work. As paramedics, it is easy to forget to take time out for ourselves. In fact, we may often feel guilty for saying no to things and saying yes to ourselves. When was the last time you took an hour doing something you absolutely love to do that brings you joy? Can you remember the things, the places, the feelings that bring you joy? When was the last time you did something just for you? When you prioritize things in your life, how high or low do you prioritize your own emotional needs? Have you ever taken the time to meditate? Do you know what meditation is? Do you understand what mindfulness is? Both of these states are very important during the development of paramedic wellness and allow you to be aware of the present moment, aware of your inner thoughts, emotions, reactions, and allows you to observe them in terms of what is arising and what is falling away. Meditation and mindfulness allows an individual to let thoughts come and go without attachment, without holding on to them, and allowing a calm and stillness to flow over you. These practices can allow for you to become acutely aware of your own mind and patterns of thinking that habitually arise within yourself, and become astutely aware of yourself, your thoughts, and your emotions. Having an awareness of these allows you to build some compassion within yourself and be able to identify when something isn't quite right. Now, paramedic wellness is so multifactorial and spans not only across your emotional and spiritual well-being, but also your physical well-being. What foods are you eating? Are you prioritizing your diet and eating healthily? This is particularly challenging, I can understand, during shift work. But taking the time to organize and plan and cook your meals prior to shift is crucial to ensuring you're eating a healthy diet. And as health professionals, we are all aware of the benefits of this. Taking time out of your day to find just a moment for you. In an environment as dynamic and changing as our own, it is important to find just a moment within the shift just for you. Take some headphones and listen to your favorite song while your partner hands over the patient, and have something to eat. Make sure you have something to eat. Or take the time to call one of your closest friends and have a laugh about something that happened 10 years ago. Whatever it is that will bring you joy, try and find time and prioritize the importance of this to you. Life doesn't need to be miserable, and we can and we are allowed to prioritize our happiness and needs just as much as we do for our patients. In a time when there is so much unrest, unknown, and overall anxiety, it is so important that we prioritize our needs as much as our patients, our families, and our workplace. If the paramedic is functioning at the highest possible level within, then everything he or she touches will be reflected in the same. A struggling paramedic can be seen through their interactions, their performance, their absenteeism, their attitude, just as a functioning paramedic can be seen through the same. It is about time that we collaboratively support each other to prioritize our own well-being so that we may start functioning at a higher level, both internally and externally. Another area that I'm extremely passionate about, and we'll touch on briefly here, is equine therapy in the management of mental health issues such as anxiety, depression, and PTSD within the paramedic community. Now, from personal experience, I can completely relate to not feeling comfortable or feeling benefits from conventional counselling or time talking with psychologists regarding issues I am facing both personally and regarding work. There have been many times when I have felt as though these services are more a tick and flick rather than a deep benefit to my psychological well-being. An area that is underrated, under-researched, and underused within this cohort is equine therapy. Equine therapy itself is essentially using a horse as a conduit for personal development, self-awareness, and identification and management of our inner emotions. Horses are essentially a mirror to your emotions and provide an immediate feedback loop to your current emotional state. If you approach a horse in an anxious way, the horse will react anxiously. Just as if you approach a horse aggressively, they will react aggressively. A horse is a mirror to your emotions and allows you to be immediately aware of the emotion you are emanating. This is particularly beneficial when you are unaware of your emotions and lack the emotional intelligence or intuition to know what emotion it is you are feeling in any given moment. This is not uncommon for paramedics, as often our emotional barometer may be a little off, as things that would ordinarily affect someone does not necessarily affect us. However, it is important to identify when something is affecting us in a negative way, rather than just repressing it and allowing it to manifest in other ways, such as a shorter fuse, struggling to sleep, frustrations, etc. And as you are aware, horses cannot speak. So any communication you undertake while doing equine therapy is on an energetic and emotional level, meaning you need to be in tune with your emotions. This fosters an environment that prioritizes self-awareness and an awareness of your emotions in any one moment. You see, There is no hiding from a 700-kilogram animal. What you give is what you get. They can feel your emotions and reflect them back to you in an instant, and you may not always like what you see. This is a great tool for people who are not willing to talk about their emotions or issues, or may even be unaware of them, or unable to relate to them as they have been repressed for so long. Equine therapy allows you to feel your way through it. You need to become very aware of your emotions and energy, which is a great way to develop self-awareness and in turn self-compassion, and will give you a deeper awareness of that conventional counseling cannot give. Self-compassion here is huge. As if the horse is reflecting an emotion you are unaware of, you're putting out. It may be quite confronting to realize you were even holding on to this emotion. For example, say a horse senses a sadness within you that you didn't realize was there, and gently walks up to you, placing his nose onto the front of your hand and dropping his head, as if in an attempt to soothe the sadness. It may have been the first time this has been reflected back to you, and may result in you identifying this feeling for the first time. This then leads you into pressing into this and why you're feeling this emotion, self-awareness, and allowing yourself to feel it and subsequently release it, self-compassion, resulting in an extremely healing and cathartic experience where perhaps not a single word was ever spoken. Horses are such energetically charged animals and rely on energy and emotions for their survival, and so are a wonderful way to teach individuals to become self-aware and manage their emotions and energies in a positive way to achieve their end objective: balance, peace, harmony, and an inner understanding of self. This year, I have the intention of opening my business, Unbridled Connections, where I'll be offering equine-assisted wellness packages to paramedics, veterans, and other first responders to promote paramedic wellness and healing, as I think this is a resource we could all benefit from. As you can see, paramedic wellness is a holistic and multifactorial area, which would require quite possibly longer than a 20-minute talk. But the premise of which is to remember that in order to be a good clinician and provide optimal care, we must prioritize our own well-being and wellness on all levels: emotional, physical, spiritual, and mental. We must encourage each other to prioritize ourselves and ensure that we are functioning in a way that is meaningful to us, and have enough self-awareness to identify when we are struggling, and most importantly, why. And have enough self-compassion to allow ourselves to fix the areas that need fixing. Paramedic wellness will look different to every individual, as what brings me joy will be different to what brings you joy. And what is important is that we never stop loving and caring for ourselves first, as if we are struggling, everything else will struggle. We are the core of our own universe. And in order for us to be able to care for and help others, it is imperative that our inner selves are completely full first. Before we can give the best version of ourselves to others, we must be the best version of ourselves first. Prioritize you. Prioritize your sleep. Prioritize your happiness. Prioritize your peace. Prioritize time in the day that is just for you to come back to yourself. Prioritize time outside, in nature, time to listen to music, to cook, to dance, and to smile. Prioritize time with your family. Life is meant to be enjoyed, and as paramedics, we are all too familiar with the speed at which life can be taken away. So let's start living our lives in a way that prioritizes our wellness, our happiness, and our overall paramedic well-being. Thank you. That's it.
Thank you very much, Marissa. That was fantastic. That was actually
Sorry
really
about my
interesting.
voice.
No, that's okay about the voice. I think this is a really interesting topic, and it's a really great topic to speak about right now. I think most of our paramedic colleagues and healthcare colleagues around Australia are at a very stressful period. This is recorded in January of 2022 when COVID at this stage is at its peak point after all the states opening. And I think it's really important to take stock and make sure that we're looking after ourselves and strategies that we can do this, because we are all here because we want to look after our patients, but we do need to look after ourselves. And I think it's easy to lose focus on that when workload is so high and so stressful as it is at the moment. If you don't mind me asking, Marissa, as far as starting self-care is concerned, if you could give us a piece of advice, where could somebody go to start this? If we're trying to think, right, I'm feeling a little bit stressed, I'm starting to feel agitated or showing signs that as an individual are starting to cause you discomfort, where would be a good place to start thinking about how I can take some steps to look after myself? What would be a piece of advice just as a beginner?
As a beginner, well, my voice is back. That's lovely. I am a massive advocate in getting outside. I know that we live in a beautiful place on the Gold Coast, so walking along the beach, putting your headphones in, listening to some music. I think music is huge. On Spotify, you can just type in like relaxing music or something, and these beautiful playlists come up, and you can just enjoy that. Or I think taking time out for yourself, like withdrawing sometimes is good, so that you can just be on your own and in your own space and in your own energy. Hiking is wonderful. Now, hiking is not hectic. Hiking is just walking in really beautiful places. So I think people think hiking is like up these crazy hills. No, you can go hiking outside in flat places, but nature is very healing in itself. And I think in a role like ours, where we're always around people, we always have to be on, we always have to be available to talk to people and calm people down and just have that emotional availability. When you're out in nature, it's sort of like a different feedback loop where you can just be quiet and calm. And I think that would be a good place to start. If you don't know much about meditation, YouTube, you can go on, there's guided meditations. Meditation is amazing, and I'm a massive advocate for it. There's a lot of scientific based studies for the scientific minded people out there who like evidence based stuff. It reduces stress, heart rate, blood pressure, anxiety, depression, everything. Teaches you about mindfulness, being in the present, all that sort of stuff. But also yoga touches on that as well. And there's heaps of free yoga, like in Burleigh even as well.
Yeah, great. I was really interested when you were talking about equine therapy and how you're looking at and expanding that and developing that too. I was wondering, how would you like to see equine therapy be accessed in the future? If you had a crystal ball or a magic wand, how would you like to see that accessed? And do you see any barriers to mainstream integration with equine therapy into mental health support? So not just healthcare professionals, but the general population as well. If paramedics are looking after people with mental health issues, can we advise patients about these sort of options and these organizations who are providing this? So I guess the question is in two parts. How would you like to see it look in the future, and how would you like it to be accessed? And do you see any barriers to that?
Look, so obviously my passion for equine therapy and stuff like that is related specifically to paramedics, first responders and veterans with that sort of anxiety, depression, PTSD or anything like that. If I could have it my way, I would love for it to be accessible. Like, you know how we've got Priority 1 and the counsellors and stuff like that. If you could have like equine therapy in there as well, that would be incredible. There's a lot of emerging evidence with the benefits of it with veterans and even prisoners over in America, but there's actually not a lot of emerging evidence in Australia about it as far as I'm aware, but I know that it's extremely beneficial, especially when conventional ways don't really work. There are a couple of places on the Gold Coast that do offer it, but not in the way that I would probably target or offer it with how I would do things. Because for me, it's not about riding the horse. It's about that connection and having the horse sort of mirror your emotions, so you can actually be in touch with what you're feeling and how you're feeling. And a lot of healing with horses is it's really powerful, but it's also not necessarily rigid. Like, it's not like a normal counseling session. I think the patient or the paramedic or whoever's with the horse sort of guides it, just because it's purely based on how they're feeling at the time and how that's reflected back to them.
And how would you, if you were looking after a patient, so a first responder who does have some anxiety and depressive issues and has come to you to look into this equine therapy and is integrated, how would you like to see that progress over time? Do you want to see these, is it better, do you think, to have sort of a camp session where you're there for a period of time, or each week, or how would it look?
Like a wellness camp where you go over a period of a week, and it incorporates not just the equine therapy, but meditation and wellness and mindfulness training, and teaching paramedics all of these incredible tools that we're not actually taught. I mean, there's really massive expectations of us to be able to deal with really huge things, particularly with COVID and stuff like that. But we're not actually really given a guidebook on how we're supposed to load share all this on ourselves. So I think having a week-long wellness retreat, which incorporates equine therapy, but all that other stuff, would be incredible, because it would allow us to learn about this wellness stuff that we're actually not taught how to do this. Like, we're all still feeling this out ourselves. And as I said, it's going to be different for each individual. But if I could have some sort of wellness camp or something where I could teach paramedics these skills that I think would definitely decrease burnout and increase longevity in the job, because it's giving us these really crucial skills to be able to maintain our functioning in the role that we have.
I think that sounds really exciting, Marissa. I think it's you said there was a little bit of data from veterans and prisoners in the United States. I actually look forward to digging up that and having a look at what they've been doing there, and seeing this grow within the Australian context. I think mental health is a priority area. I know that it's a priority health area in Australia at the moment, and lots of really smart, interesting people are developing all sorts of different strategies to support everyone with mental health disorders. And again, this talk comes at a really opportune time where workload and burnout and stress in the healthcare industry and within the community is at an all-time high, really, at least in my career. And I think it's a really important thing that you've touched on today, and I'm really looking forward to seeing what you do in the future with all of this. It's been fantastic. Thank you so much for coming onto the webinar.
Excellent. Thank you so much for having me. It's been a pleasure.
Thank you, everyone, for joining. This will be uploaded onto YouTube in the coming days. Wish you all the best, and we'll see you next month for another ACPP webinar. Take care.